Okay, now that we have done the formation of the different vectors in case of ventricular depolarization, it's time for our last thing, that's the ventricular repolarization. So there is a really important concept and sometimes confusing that needs to be cleared at this point. So we know that in case of depolarization, the movement of the depolarization wave is from endocardium to epicardium. And the reason for that was that the Purkinje fibers terminate in the endocardium part. Therefore, the endocardial cells would be the first to depolarize. Okay, and the epicardial cells will be the last to depolarize. That being said, if we think what would be the direction of the repolarization, we will say that the repolarization should also be from the endocardium to epicardium. And you will reason out that it is because the endocardium was the first to depolarize, therefore it should be first to repolarize because the endocardial cells have enough time to come back to normal. But this is not the case. When we talk about the repolarization vector of the ventricles, we need to understand that the repolarization starts from the epicardium and ends in the endocardium, which is contrary to what we were thinking. We were thinking that the repolarization should begin from endo to epi because endo cells were the first to depolarize, but it's not like that. The repolarization starts from the epicardium, that is the outer layer of the heart, and moves inwards, that is towards the endocardium. What's the reason behind that? So the main reason why the endocardium repolarizes first is that it has been seen that the action potential of the endocardial cells are longer than those of the epicardial cells. Therefore, epicardial cells recover quickly and hence they are able to repolarize before the endocardial cells repolarize. Okay, so the action potential duration of the epicardial cells is shorter and hence they recover quickly. Therefore, the direction of repolarization has to be from epicardium to endocardium. Now, this is important to know because this is the reason why we have a positive deflection of the T wave. Okay. Whereas when we talked about the atrial repolarization, in which we talked about the TA wave, which represented the atrial repolarization, the repolarization vector was in the opposite direction of the depolarization vector. It was because the cells that were first to depolarize were also first to repolarize. But that concept does not hold true in case of ventricular repolarization. Here the cells which are first to depolarize are last to repolarize. Therefore, we have the positive vector of ventricular repolarization in this case. Okay. So the question is, why is the repolarization positive in this case? Now, if you see, the repolarization will move from epicardium to the endocardium. The negativity is moving from this side to this side. Okay, so the arrowhead is actually negative and the tail is positive, and the direction is towards the left side in this figure, which is towards the endocardium. Now, if you have a recording electrode placed here, you will see that that recording electrode is facing the positive side of the vector, hence the deflection would be positive. But whereas when you talk about the atrial muscles, this is what happens in the atrial muscles. In the atrial muscles, the wave of repolarization is directed this way. Okay, so the arrowhead represents the negative polarity and the tail represents the positive polarity. Why is the direction downwards? Because the cells which were first to depolarize were also first to repolarize, and hence this part of the atria, the downward part of the atria, would be last to repolarize, and hence the negativity is moving downwards. Now, if you keep a recording electrode here, you will see that the negative side of the vector faces the recording electrode, and hence the reflection is negative. In general, in case when we talk about the atria, the depolarization and the repolarization vectors are opposite, but when we talk about the ventricles, it's in the similar direction. And the reason for that being is that in case of the ventricles, the concept of that the cells which are forced to depolarize are also forced to repolarize does not hold true, because in case of the ventricles, the epicardial cells have a very short duration of action potential. They recover quickly, and hence the repolarization begins from outside and goes towards the inner layers of the heart.